Good morning and welcome to the Food Access and Health Workgroup Winter Webinar Series. My name is Angie Tagtow and I'll be your host this morning for the webinar Growing Solutions, a Social Marketing Approach to Food Gardening in Iowa. This is the first webinar in our winter webinar series, and I hope you do look for an invitation to join our second webinar, which will be held on March 13th from 10 a.m. to 11:30. And the Food Access and Health Work Group has partnered with the Regional Food System Working Group on a webinar titled Community-Based Food Systems, an establishing healthy food access through community-based food systems. And we get to feature some really great panelists, including Kimberly Hodgson and Jason Grimm and Teresa Wimmerslag and Alexi Rementhal. So please look forward to that webinar coming up in March. Thank you for joining us this morning. We've still got more attendees coming on to the webinar. All attendees are on mute this morning, and if you do need to send a question during the webinar, I encourage you to use the chat feature on your GoToWebinar control panel. And I also want to thank Luther College today and the Center for Sustainable Communities for hosting the internet access for me today. They've really been very helpful with getting this set up today. Just a little bit of background on the Food Access and Health Work Group. The work group is a vibrant statewide network of more than 210 partners, and we have extensive diversity among our partnership and includes food and nutrition assistance program administrators, emergency food system providers, public health professionals, community-based organizers, and food system stakeholders. And we're all focused on cultivating a diverse and just food system that eliminates hunger, increases access to nutritious food, and advances the health of all Iowans. The Food Access and Health Work Group is a subunit of the Iowa Food Systems Council, and our emphasis is really on that intersection of community-based food systems and healthy food access. The Food Access and Health Work Group is considered a community of practice. And communities of practice are groups of people and organizations who come together to share what they know, to learn from one another regarding some aspect of their work, and to provide a social context for that work. Because communities of practice are voluntary, what makes them successful over time is their ability to generate enough excitement, relevance, and value to attract and engage members. We function strategically as a catalyst, for example, for cooperation of diverse interests to create solutions for healthy food access for all Iowans. The Food Access and Health Work Group also functions as a hub, which create, capture, document, and leverage knowledge and deploy this knowledge as technical assistance to assist food access and health partners. FOG also functions as a magnet to attract funding for leveraging, channeling, and distributing funding to research and development efforts for decreasing food insecurity. We also function as a scout to identify emerging opportunities that advance healthful food access with potential to deliver benefits to all FOG partners. We have just launched a new leadership team for the Food Access and Health Work Group. We are using a shared leadership approach to the Food Access and Health Work Group. And so I'd like to thank the following individuals for stepping up in January and volunteering their time to be on the leadership team. The leadership team functions include outreach and leadership development, policy, partnerships, and surveillance, and we still are looking for more partners to join the leadership team, specifically in the areas of overseeing the Nourish Iowa Award, as well as assisting with sustainability of the work group and our resources. So today we're talking about social marketing and food gardening. And before I transfer it over to Betsy, I wanted to give a little background this morning on social marketing. Social marketing is really a strategy for gathering information about a population, using that information to create very specific marketing strategies. And it's marketing strategies that do not get us to buy something, but marketing strategies that influence our social and behavioral environments. Public health has used social marketing very effectively in their campaigns. And so, our focus with this webinar today is looking at social marketing strategies to encourage more Iowans to garden and to encourage current Iowa gardens to think about donating extra produce during the season. Just a brief overview of our process. The funding for the Iowa Food Gardening Social Marketing Initiative has been generously provided by the Wellmark Foundation. We started this process about a year ago with the conceptualization and the funding aspect, and we spent about 10 months collecting data from a variety of groups, and that's what Betsy will be talking about today. We are currently in the phase of message development where we've taken all of this data, shared it with a marketing team based out of Des Moines, and they are helping us craft our social marketing messages and materials to support food gardening initiatives in Iowa. Campaign launch, I hope everybody marks their calendars, is going to be April 19th. And so invitations will be going to all of you to invite you to participate in the April 19th Spring Fog Gathering, which will be held at the Iowa Arboretum in Madrid. The times are tentatively set from 9 a.m. to 3 p.m. So look for more information on that. We will be spending most of the growing season this year with implementing these various marketing strategies and using campaign materials with our FOG partners. And of course, we'll round out our year with evaluation. A document that I want to bring your attention to that really helps support this webinar today is the executive summary that we assembled a couple of weeks ago based on the various assessments that were conducted for this project. And you can access this report on the Iowa Food Systems Council website. There's also another report that may be of interest to attendees today. That report is more of a white paper, a literature review on the benefits of food gardening. That report is titled Growing Solutions, Cultivating Health and Food Security Through Food Gardening in Iowa. So both reports are right next to each other on the food gardening webpage of the Iowa Food Systems Council. Also want to let you know that the webinar is being recorded today and will be posted on that website as well. And it is my pleasure to announce our speaker this morning, Dr. Elizabeth Danforth Richey. Betsy is an applied anthropologist who focuses on the experiences of communities and the multidimensional factors that impact food security and health. Betsy holds an MPH in Global Health Practice and Policy and a PhD in Applied Medical Anthropology. Her areas of research have included maternal health access and adolescent nutrition in Tanzania, social services for people with disabilities, and nutritional outcomes of indigenous populations in Costa Rica. She currently works at the Iowa Department of Public Health, where she oversees data integration and analysis for maternal and child health programs. And Betsy has just been a wonderful asset to this project as she's the evaluator for the Iowa Food Gardening Social Marketing Initiative. And so with that, we will pass this over to Betsy.
All right, thank you, Angie, very much. I'm just going to give kind of a very brief overview of the assessment piece that we've done for the Iowa Food Gardening Social Marketing Initiative. Basically, this initiative is kind of a three-pronged attack. on encouraging food gardening. So first, we're creating messages to encourage gardening among low-resource Iowans. We are also trying to promote produce donation among current gardeners to food pantries. And then we're also working with the Food Access and Health Work Group to facilitate and support these projects, because really they're the ones that are going to be intimately engaged in all of these activities. So as Angie said, kind of step one of social marketing is to assess the existing needs and opportunities that might impact the desired behavior change. So that's kind of what we've been trying to do for the last year. We used a social ecological approach to this project, which is outlined in the Growing Solutions document that Angie mentioned. And basically, it's looking at all of the different layers that might impact somebody's behavior. So looking at individual factors, household factors, organizational factors, community factors, and then overarching policy and economic factors. So we really tried to look at food gardening and produce donation from lots and lots of different aspects. And we have 5 pieces to our assessment. The first was a semi-quantitative survey with FOG partners, and the goals of this was to assess partner organizations' experiences with food gardening and produce donation activities, their support of this project, and lessons learned that they've had with gardening. Next, we worked with food pantries. We did focus groups in partnership with the Iowa Food Bank Association, and we wanted to learn about produce donation and acceptance practices at food pantries, their ability to provide nutrition education and promotion messages, and their challenges to message and produce distribution. Next, we held a semi-quantitative survey with low-resource Iowans. For this survey, we partnered with 9 agencies in Iowa, including WIC, Iowa Workforce Development, Area Agencies on Aging, and 6 other really great organizations. And we wanted to look at the knowledge, attitudes, and practices related to food gardening and produce consumption among low-income Iowans. Next, we did an online survey with food gardeners with Iowa State Extension and Outreach Master Gardeners program. And we wanted to understand current produce donation and food gardening activities, as well as gardeners' challenges to produce donation. Finally, we're in the process of conducting a literature review looking at policy to understand existing state and local level policies that either encourage or inhibit food gardening in communities, and this analysis is currently in progress. And so finally, we're trying to triangulate all that data, or put all of these pieces back together to identify key themes that cross-cut all of these actors and ways that we can create a really effective social marketing campaign. So first, looking at FOG partners, we had 49 responses from 44 agencies, which was a great response rate. About 3 out of 4 already participate in some sort of gardening activity. And this really shows that partners have experience with gardening, and they really recognize the benefits of this type of activity. The 2 main challenges that organizations provided were, no surprise, they're kind of the big challenges for any project, is staff and volunteer time and budget, which I'll outline a little bit on the next slide. So basically, we found that outreach, recruiting, basic gardening information, and collaboration would help agencies expand or initiate gardening. Of those partners who have considered gardening projects, 35% wanted to do some sort of promotion project, 41% said they had considered gardening education. So a social marketing campaign really fits in line with these types of initiatives. And then we asked partners about lessons learned with gardening. And they're basically that you need to keep people engaged. You want to make sure that they want to garden. And then positives about providing this type of support, that almost everyone is interested in food for the hungry. And there's a lot of willingness of individuals to grow their own food. So there's kind of this very positive basis. And then the comments highlighted the need for client engagement and empowerment. And the approaches really need to be collaborative rather than a top-down, do this, do that type of approach. So looking at challenges, we can see that budget and staff and volunteers were the 2 top things, and then they kind of drop off after that. But organizational motivation and support was also important, a lack of interest among target audience, and knowledge. So these were things that need to be addressed through a social marketing campaign as well. And then kind of on the flip side, we looked at produce donation among our partners, and almost half are engaged in produce donation activities. And engaged was very broadly defined as actual donation, promotion, advocacy, or acceptance of produce. The main barriers to expansion were lack of informational resources and lack of knowledge, and the biggest external challenge was lack of awareness. And looking at other comments, again, it's similar to the gardening comments that lack of money, staff, and time to expand or initiate these types of activities were major challenges. We really found that advocacy, public information about donation, and encouraging messages would help agencies expand produce donation in their communities, and these are all things that social marketing was really good at addressing. When looking at lessons learned, they were really positive. It's contagious. Seeing donations by others leads to donations, so people get the idea and then they want to help. And also to keep fresh produce simple, that we need to focus on commonly consumed items that can be useful to low-resource Iowans. I just wanted to share a couple more quotes that we got from this survey. The first one really highlights the positive aspects of donation. Zucchini is a gateway drug to donation. Once you get growers hooked on how good donating feels, they will share other produce as well. And then also just this really big support in gardening that I think is out there right now, that it addresses lots of issues: obesity prevention, access to healthy foods, as well as education such as STEM skills and concepts. We also found that there is a need to address larger issues outside of food gardening, that it's really just one piece in food security. One respondent said, the opportunity exists, but we need to help people understand how good fresh fruits and vegetables taste and how to store and preserve them. So this nutrition education piece is really important to align with this project. Many of the challenges reported might be addressed through social marketing campaigns, which can really work to increase knowledge, resource, and partners. Moving on to food pantries, we conducted focus groups with 30 emergency food providers throughout the state, and this again was in partnership with the Iowa Food Bank Association. Knowledge is seen as a barrier to healthy foods. Although healthy eating messages are seen as a major need among the emergency feeding network, that people need more education on healthy eating, and definitely about gardening, that there was, all the respondents expressed that gardening was really something that there was a lack of knowledge around. All of our partners accepted fresh produce when it's available. Unfortunately, it's only usually available a few months a year. And they said that other fruits and vegetables that they can distribute may not be as healthy. Most donations are canned, so they contain high sodium, preservatives, etc. And partners really saw that fresh produce was the healthiest option for their clients. They accept produce from a variety of sources, including restaurants, retail outlets, farmers markets, community gardens, private gardeners, basically anywhere you could get produce from. They also saw minimal donations of plants and seeds. A few had received plants and seeds, but not very many. One of the most recurring messages that we heard from food pantries was that they want to provide healthy eating messages. However, there's often a lack of fresh and healthy foods at the food pantry, so they can't support their messages with the food that they're providing. So there's this disconnect. And so having more produce donated would really, really help in a lot of their activities. Food pantries really reported only positive responses from clients regarding fresh produce. One said it never gets left behind, and that's very promising. Families definitely want it. So there is this really positive side of clients looking for fresh produce. Challenges to distributing produce include time to distribution and spoilage. Many pantries are only open a couple days a week, so it can be difficult for them to accept produce because it isn't as shelf stable. So if they accept the produce on Monday, it might not be good on Saturday when they're distributing food. So kind of the logistics of produce donation was a challenge. We found through these focus groups that an initiative would be best aimed at the food pantry level rather than at the food bank level. A lot of pantries said it wasn't feasible to get fresh produce from a bank, One said we order every 60 days, which is too long. So really getting the produce directly to the food pantry is important. If we are to work through food banks, we need to look at creative distribution initiatives. One food bank said that they had started using produce trucks to get produce to agencies quicker than other foods. Agencies also have limited time with clients, so they need short, simple messages. One said, right now we only get about 5 minutes with a client. We're constrained by space, staffing, and time. So any sort of message we develop needs to be quick, to the point, easily understandable, and easy to fit into the existing workflow of the organization. And positive messages by word of mouth were said to be the most important. As one respondent said, we need a positive message, not just don't eat this, don't eat that. So with our social marketing campaign, we're really trying to look at the positive sides. We're not trying to, discourage types of eating, but really rather promote healthy eating. So our next piece was a survey with low-resource Iowans. This was fielded between August and October of 2012, and surveys were available in both English and Spanish. We had a really great response rate for this survey. We had 855 responses, which represented 78% response rate. And we partnered with 9 agencies to implement this survey. And you can see what agencies are below. There was a lot of different strategies used. Really, we tried to work the survey into the existing flow of work that the agencies do. So we did face-to-face interviews. We also did some self-completion interviews. It really just depended on how it would work for each agency. And you can see what survey topics we focused on: demographics, media use, food aid, produce consumption, and then gardening. Okay, here's a slide of the demographics from the survey. I know it's really busy, but hopefully you can have a chance later to look at these slides and maybe take it in a little bit more. I just wanted to point out a couple things. Most of our respondents were women. We had over 80% response rate of women. That's largely because of the partners that we sampled with, including WIC and other organizations that women tend to access more than men. We had a pretty young sample. 38% were in that youngest age category. We had a pretty good representation of Spanish speakers. We tried to oversample a little bit on this, and we had about 13% who spoke Spanish. Another thing that I wanted to point out is under housing, over 50% of our population rents. And looking at that from a gardening perspective, this can be really important in the messages that we provide and focusing more on container gardening rather than having a yard to garden in. Looking at the demographics, kind of unsurprisingly, younger respondents were more likely to worry about and not be able to pay household bills. Basically, 4 out of 5 respondents in that youngest age category said that they worried about paying bills. Half of respondents in the 65 to 79 age category worried about paying bills, but half is still a significant amount. So there are a lot of economic challenges among our population. There really was little difference in worrying about an ability to pay bills with language or urban or rural living. So it was pretty consistent across those domains. Again, media use was pretty unsurprising, which is good. It means that we have a nice representative sample. Younger Iowans tend to use social media at higher rates. Women use social media more than men. And there wasn't any difference in social media use by language or urban or rural living. So this chart kind of illustrates trends that we saw in social media use. 1 in 4 gets food from the food pantry. Again, because of our sampling strategy, this may be a little off and maybe a little bit high. But 70% of those who do receive food at least receive some fresh produce, which is positive. It means that it's out there. 70% of those who don't receive fresh produce would like to. So that also shows that people want this resource. Among those who receive fresh produce from a food pantry, almost half eat all of it. Those that don't eat all of it said that they most commonly give it to others who need it more, or they're faced with spoilage challenges. People who use food pantries tended to be younger, tended to worry about paying bills and also were unable to pay bills at least sometimes. 6 in 10 of our respondents used WIC or food assistance to purchase fruits and vegetables. And 4 out of 10 used WIC or food assistance to purchase fruits and vegetables from a farmer's market. There's also a similar rate of respondents over 65 who use the Seniors Farmers Market's nutrition program. So they are finding ways to access produce. Respondents who used WIC tend to be younger, women, speak Spanish, have children in the household, and then have worry and aren't able to pay bills. From an educational perspective, an interesting finding was that 3 in 5 didn't know that food assistance could be used to purchase vegetable plants and seeds. So in our gardening campaign, this can be an area for education. Then we looked at actual produce consumption. Respondents reported pretty high produce consumption, but we didn't directly measure food consumption, and results from other studies show that actual consumption is probably much, much lower than this. But this shows that people perceive themselves to be eating enough fruits and vegetables. This consumption didn't vary by gender. However, people with less education were more likely to feel that they eat enough fruits and vegetables, which was interesting. Spanish language speakers also thought they ate enough fruits and vegetables, as well as respondents with children in the household and respondents who used WIC. Worrying and ability to pay bills were inversely related to produce consumption, so the more they worried or the more they weren't able to pay bills, the less likely they were to say that they ate enough fruits and vegetables. So that really shows that cost is a big challenge to fruit and vegetable consumption. And they ate a very wide variety of fruits and vegetables. This chart looks at reasons for those who report not eating enough fruits and vegetables. And if you look at the very bottom of the chart, by far the most common reason is cost. Over almost 90% said that cost was a barrier to eating enough fruits and vegetables, followed by not thinking about eating more, which was much, much less than 40% said that. So really this illustrates the significant cost challenges that people face in healthy eating. 7 in 10 respondents were at least somewhat interested in food gardening. 10% weren't interested at all. But this shows that there is this idea out there and people are interested in it. It varied with education and eating enough fruits and vegetables. Among people who had less than 12 years of education, only 65% were interested in food gardening. But of those with college degrees, over 80% had considered it and were interested in it. Also, thinking that they ate enough fruits and vegetables led to more interest in gardening. So being interested in it from one perspective kind of shows that they're interested in it from multiple perspectives. Urban residents also reported being more interested in food gardening than rural residents, which was an interesting finding. Almost 80% know someone who gardens. And this is important from a social marketing perspective because having knowledge of the behavior and knowing people who already do the behavior leads to a person being more likely to do it themselves. And people who know people who are gardening tended to be more interested in gardening. They really felt very positive about produce. Almost 100% said they felt positive about eating fruits and vegetables. 75% said they felt positive about growing their own fruits and vegetables. Over half would like to learn more about growing fruits and vegetables, and this was related to interest in knowing someone who gardens. So again, this shows this importance of social networks among gardeners and linking gardeners to other gardeners or other potential gardeners. We asked directly about gardening practices, and it was basically split into thirds about who had, who hadn't, and who didn't currently but have in the past. So 6 in 10 had either grown vegetables or fruits or had in the past. People who currently garden are more likely to eat a diet consisting of half fruits and vegetables and to think that they eat enough fruits and vegetables. Unsurprisingly, they're more interested in gardening, more likely to know someone else who gardens, and more likely to want to learn more about food gardening. They're also older, have more education, more likely to own their own home, have lived in their current address for more than 2 years, and utilize WIC. The most commonly grown foods were tomatoes, peppers, and cucumbers, which are similar to the most commonly eaten foods, so it's nice to have that alignment. They grow foods in a variety of places, most in their yard and only 14% in a container. And when we think about that 51% who rent, container gardening can be a really important um, way to promote gardening. So there is this kind of disconnect or this opportunity to encourage container gardening. We asked clients or participants why they garden. The most important was to have healthy food and, again, to save money. So this highlights that economic challenge again. The most common reasons for having gardened in the past but not currently doing so was lack of space, lack of time, health barriers, a lack of money, and other kind of external circumstances. These results really show that low resource Iowans face challenges economically in accessing fresh produce, yet they really want increased access and they're interested in food gardening and they feel positive about issues related to food gardening and produce consumption. So these social marketing campaigns that encourage food gardening can address economic and logistical challenges to increase produce consumption and will focus on a really simple, positive message. So I think that there's a lot of opportunity there for a social marketing campaign to have a big impact in encouraging people to garden to improve their fruit and vegetable consumption. The final piece of research that I want to tell you about is current gardeners. We partnered with the Master Gardener program at ISU Extension and Outreach, and we did an online survey. We had 64 responses, and the most commonly grown produce were tomatoes, peppers, and beans, which are very similar to what low-resource Iowans most commonly consume, so it's a nice alignment there. The reasons why they food garden are personal enjoyment, health, and better tasting food. Interestingly, 33% listed food to share or donate as a very important reason as to why they garden. So there's already kind of this idea out there among some of our gardeners. When asked what they do with extra produce, 27% said they donate to a food assistance program. So a few are out there doing it, but there's a lot of room to improve that rate. We asked clients if they knew of food assistance programs in their community that were willing to accept donations of fresh produce, and more than half didn't know. So there's a lack of knowledge about produce donation. There's even less knowledge about plant and seed donation. This idea is really not thought of at all. So just creating awareness is important among gardeners. We asked how often they had donated fresh produce to a food assistance program, and 65% have never donated. So again, there's this big pool of resources out there that are untapped. But we do have some rock stars out there. 6.3% said that they had donated more than 10 times a year. So again, there are people that are out there doing it. It can be improved. A lot of gardeners had never thought about produce donation. One respondent actually said, "This is a great idea, and this survey actually brought this option to my attention." So really just creating awareness can be very effective, I think. Concerns included client ability to use produce, which is a concern also voiced by food pantry respondents, although the food pantry respondents reported that produce is gone very, very quickly from their sites, so this might kind of be an unfounded concern. The timeliness of distribution, and again, that was another reality that food pantries faced as well, and food safety liability. And this one is important because there are regulations and rules in place that protect people from any sort of liability in food safety. So this is really an education piece to get it out there that it is a safe and easy thing to do. 3 out of 4 said that they would or may plant more if there was a food assistance program to accept produce donations, so that was a really positive response. They said the convenience was really the main thing that would encourage people to donate. And this was even more than recognition or coupons or any sort of financial benefit, that it's convenience that they'd like to focus on. And so with our program, we really see the need to work with food pantries to ease that process and to make donation easy and accessible. So there's lots of room for messaging to have a really big impact with food gardeners. We need to raise awareness, we need to improve knowledge, and we need to improve convenience for people to donate. So basically, all of this research found that our FOG partners are supportive, but lack the time and money to expand their gardening and produce donation activities, that food pantries love produce but lack the time for complex messages, and they lack food to support healthy eating messages. Low resource Iowans were positive about eating fruits and vegetables. They face cost as a barrier to eating more produce, and they're interested in food gardening but lack the space and time to do so. And gardeners lack awareness of donation opportunities. They have concerns about liability, and they really feel that convenience is important. So from these conclusions, we're basing the social marketing campaign that will encourage low resource Iowans to garden and will encourage people to donate extra garden produce to food pantries. And we hope that this information can be really effective in creating meaningful, effective programs and messages. So that's a summary of the research that we've done so far, and I'm going to turn it back over to you, Angie.
Great, Betsy. Thank you. Thank you very much. Get it back to my screen here. And so I encourage everybody at this time to send in your questions. We already have a handful of questions coming in. Use the question function in your control panel on your screen. And just a reminding that the recording from today's webinar will be available on the Iowa Food Systems Council Food Gardening webpage. Give us about a week to get that loaded, and we'll include a link to all of the FOG partners in the next update. And also a reminder of the next webinar that's coming up on March 13th, Champions of Change, Establishing Healthy Food Access Through Community-Based Food Systems. So hope you all will be able to join us for that. And like Betsy said, our challenge at this point is taking all of this phenomenal data and information and being able to craft two specific social marketing campaigns. The one being to encourage not only low resource Iowans, but essentially all Iowans to think about gardening as a way of perhaps improving self-sufficiency, improving household food security, putting fresh foods on their plate, and hopefully improving health. But also a campaign that's focused on gardeners to encourage them to grow a little more, harvest a little more, or glean a little more and donate that extra produce to a food pantry or other community-based organization. So Betsy and I have had the wonderful opportunity of being able to work with the American Advertising Federation Des Moines chapter on creating the two campaigns. And what has given us not just one point of contact or one individual or two individuals, but actually a team of about 12 individuals that are now using all of this information to really craft some phenomenal messages. And we would like to share with you just a sneak peek of the campaign that will be launched in April. Cultivate Iowa will be the theme of the campaigns. And April 19th, we invite all FOG partners and others to attend the FOG Spring Gathering at the Iowa Arboretum in Madrid. And FOG partners will actually be given campaign materials that they can then go and use in their offices, agencies, clinics, what have you. We will have presentations on the materials, probably a little overview of what you heard today, tools and tips for implementation, and lots of other materials as well. We also will have lots of really great gardening door prizes. So you will be assured to leave with just some awesome materials on April 19th. We will also be using April 19th as a media event as well, and attracting media to help us convey these messages. So Cultivate Iowa is the campaign theme. We are going to use Plant, Grow, Save as a tagline for encouraging low resource Iowans and all Iowans to consider gardening. And the other tagline that we're considering using is Plant, Grow, and Share, specifically targeted to gardeners in Iowa to increase their donations to food pantries and to community-based organizations. And a couple of other dates to put in your calendar. In addition to the April 19th spring fog gathering, the summer fog gathering will be July 12th, and the fall gathering will be October 4th. And the locations for both of those gatherings will be announced at a later date. And also to plant the seed, if you will, to think about candidates for the 2013 Nourish Iowa Award. We hope to get those materials out in June. And so think about some of your colleagues and folks in your network who are doing some awesome things in Iowa to increase healthy food access among all Iowans. And so with that, we're going to switch over to our questions. And I know we have several questions that have come in here this morning, and we'll do our best to answer them. The first question is have you considered a mobile unit for distribution, a roving farmers market through low-income areas, and perhaps even establishing an EBT card system? And Deborah, I'll respond to this question. This particular project is not a community-based project per se. We're focusing more on social marketing messages versus actual deliverables within communities. But I would encourage you to connect with the Northeast Iowa Food Bank. They do have a mobile food pantry in which they're using. I'm not aware of any mobile farmers markets yet in Iowa, although I know that communities have discussed it. So excellent question, Deborah. I encourage you to connect with the Northeast Iowa Food Bank on that. Next question is to clarify, Betsy, again, what types of knowledge the food pantry, let's see here, what types of knowledge they thought they were lacking. In the food pantry surveys, what types of knowledge did they think that they were lacking? I'm not sure as to the question, but maybe you can expand on the focus group items.
Sure. Actually, we didn't get a whole lot of information about any specifics. Food pantries kind of reported that they thought that there was this room for nutrition education, that they thought that clients might not know how to use fresh fruits and vegetables in cooking and healthy eating. They really didn't give any more specifics than that. And I think it's just kind of stemming from a larger concern that people are eating, they know that people eat unhealthily. We know that people don't consume enough fruits and vegetables or as much as was recommended. And, you know, kind of exploring why that might be the case. And I think a lot of the food pantries kind of went to knowledge that maybe people just don't know how. However, looking at the other side, later in the surveys or later in the interviews, respondents really said that produce was very popular and that it goes very quickly and that people want it, and you know they were very positive about it. So I think that we'll have to look a little bit more in depth if we have the opportunity to do future research at this kind of disconnect between believing that there is a lack of knowledge, but then people also being very positive about fruits and vegetables, and to kind of see if that lack of knowledge really exists, or and in what areas and how we can address those specifically. So I think that's a great question, and I think it's really a opportunity to drill down further and to do some further research into that.
Yeah, absolutely. Thanks. Next question has to do with maybe clarifying the set of questions that we asked in the low resource Iowan survey about the consumption of fruits and vegetables. Can you just go through that one more time as to the questions that we asked were their perceptions on quantity?
Sure. So basically, since we didn't have the resources to do really in-depth analysis of tracking people's eating patterns, really all we could do was ask about their own perceptions of fruits and vegetables. And so on slide 12, which I think we will send out the slides to everyone, excuse me, that's the wrong slide. We asked basically two questions about produce consumption. I'm sorry, this is on slide 15. So we asked, do fruits and vegetables make up about half of what you eat in a day? And so this was trying to get at that my plate recommendation of eating half produce in a day. And then we also asked, do you eat enough fruits and vegetables? Just very simply, very directly. So we really weren't looking at, breaking it down by meals or, tracking it more in depth. These questions were really more about respondents' perceptions in eating fruits and vegetables, because really that's what's important when we're addressing them in a social marketing perspective, is how do they perceive their current diet and how can that be improved. So we really just were trying to get at perceptions. And I think that's why we see such a disconnect between, we had 66% say that they do eat enough fruits and vegetables. But when you look at surveys that are able to drill down a little bit more and ask a little bit more specific questions or actually track people's eating habits, it's much lower. I think BRFIS, the behavioral risk survey, comes back with about 14% eating half fruits and vegetables. So I think that there is this big disconnect. And again, it's an area that I think we need to look into further, and other research has. But this shows that people do perceive themselves to maybe be eating more fruits and vegetables than they actually are.
Mm-hmm.
And then we kind of just followed that up with asking what are the most commonly eaten foods, as to just get a sense of, if we do have people donating to food pantries, what are going to be the most useful foods to have.
Mm-hmm. Good, thanks, Betsy. Next question comes from Claudia, and Claudia asks, are produce donations tax deductible? And I hope I'm accurate in saying this, but right now, if you are a backyard gardener or community gardener and you donate produce, it's not necessarily tax deductible. But there is currently a Senate study bill looking at farmers who donate fresh produce to community-based organizations to receive a tax credit. And so I don't have that number here in front of me as far as what that Senate study bill is. But for backyard gardeners, I don't believe there is a tax deduction. But if you are a farmer and grow specialty crops, fruits and vegetables, look for a Senate study bill that does have a tax credit for farmers who do donate to community-based organizations. So great questions, Claudia. Well, the
Angie,
handouts, yes.
that the Senate study bill is SSB 1177.
Good, thank you for getting that. So, Senate Study Bill 1177, something to look up. The Senate Study Bill also is focused on providing emergency food assistance funding by the state for low-resource Iowans, and this would be working with Department of Human Services and the Iowa Food Bank Association to do that. So definitely a bill that you may want to check out. Will the handouts be available? What we'll do after the webinar today is we will post the recording as well as the slides to the Food Gardening website. And so give us about a week and we'll get those up and ready for you. Next question. This is from Sue, and Sue asks, in the past when we worked with low-income audiences on gardening, long-lasting engagement was absent and that the mobility of clients was high. Any ideas how we could address that barrier? Betsy, you want to tackle that?
I think that's a big problem that a lot of social services face. In my other job, I work for the Bureau of Family Health at IDPH, and we see that a lot with our clients as well. But we're hoping that this campaign, being statewide, that if participants are mobile, that they can access these resources if they move from one food pantry to another. And so by having this kind of broad base, we're hoping that there will be multiple avenues for people to see these messages and to get these messages.
Great, thanks. And we have had lots of discussions about that as well, and what type of gardening, is most adaptable to mobile populations. And container gardening might be a solution to that. This is your last chance. If you have any questions, to send them in. Well, with that, we thank you for joining us for this webinar today. If you'd like to send any feedback to Betsy and I about this webinar and/or ideas for other webinars, please use my email address that's on the screen. We'd love to have your suggestions and feedback. And also, we encourage you to take a look at the Iowa Food Systems Council website. It is a member-based nonprofit organization that helps support things such as food access and healthful foods through community-based food systems. And so we encourage you to check out the Iowa Food Systems Council webpage. And with that, we thank you very much, and please look for the recordings and the slides on the Iowa Food Systems Council Food Gardening website within the next week. And thank you, and have a great day.